is Alia Sahni, and I am a recent medical graduate from St. George's University of London, so now I'm an F1. Today I'm going to be speaking to you guys about obstructive sleep apnea. It's a topic that's not very big but does come up in loads of exams, and I think I've had a question on it in every exam I've done up till now. So it's a great topic to just kind of go over quickly, refresh yourselves, and if you've never heard about it before, then this is a great way to learn it as well. If you have any questions for me, feel free to message me on my Instagram, which is at Alia Sahni, so ALIASAHNI, or you can email me at aliasahni@gmail.com as well with any questions. And it doesn't have to be just about this topic, feel free to message me about uni or anything else that you have questions on. Alright, so let's begin with obstructive sleep apnea. So this is just to give you a general idea of what we're going to discuss, the definition, risk factors, and all these other things, etc. So it's great to always start with a case presentation. So let's do that. So this is a case that could present to you when you guys are doctors. So 60-year-old overweight man with excessive daytime sleepiness and episodes of apnea. Everything in red, of course, are key symptoms that you will see in these kind of in obstructive sleep apnea case. And he is presented to the GP. His wife has also noticed episodic gasping while he's sleeping and complains about his terrible snoring. He wants to figure out what's going on because he wakes up and he's tired every morning. So on examination with this patient, he's obese and has a large neck circumference. Other things that you tend to see is a very apparently large tongue. In some cases you may see larger tonsils, uvular thickness, and signs of a narrowed oropharynx, because that's the real cause of obstructive sleep apnea. So what's the definition of obstructive sleep apnea? So it's a sleep-related breathing disorder that involves a decrease or complete halt in airway flow. And it's not that there's no effort to breathe, but rather when the muscles relax during sleeping, they cause soft tissue in the back of the throat to collapse, and that blocks the upper airway. So here's an image just to give you a general idea. So you can see it's clear in the non-obstructive airway, there's a clear open path going down the throat, but in the obstructive airway, that tongue has now relaxed so far back that it's almost completely occluded the oropharynx, going into the larynx, and thus there's not really much airflow going through, and that can lead especially to that gasping symptom, is because these patients are struggling to breathe. Now, snoring is actually because during snoring that tongue moves up and down, which means that more air can force itself through. That's why these patients also tend to present with snoring. So what are some of the risk factors of something like this? So some of the risk factors is most of these patients tend to be obese or overweight. They also have very large neck sizes. So you're not going to tend to measure their necks, but it's something that you would be able to see. They usually tend to be middle-aged men, and can also be postmenopausal women. That's also when you can see a gain in weight. You'll see sometimes that they may have abnormalities of the bony and soft tissue structure of the head and neck. So anything really that can narrow that oropharynx. It's common as well in people in adults or children with Down syndrome, children with large tonsils, which means there's something else blocking it. When their tongue relaxes back, there was already an obstructed airway and now that's further obstructed, and then a family history of obstructive sleep apnea as well. So what investigations can we do for these patients? So there's two things. You can assess their sleepiness and then you can do a diagnostic test. So to assess their sleepiness, you have a questionnaire completed by the patient and their partner, because of course the patient isn't aware of everything they're doing in their sleep. And then also you can do a multiple sleep latency test, which measures the time it takes for you to fall asleep. And it's using EEG criteria. So really you're doing an EEG. And the other thing you can do is a sleep study, so polysomnography. And that ranges from monitoring pulse oximetry at night, because if it's blocking them, then you want to see if there's a big drop in their saturations, or to a full one, which is EEG, respiratory, airflow, actual movement of their chest, any snoring. And that really depends on a patient-to-patient basis. Not every patient needs a polysomnography. Some patients have very, very obvious symptoms and you can tell what the diagnosis is. But if you're a little bit confused or unsure, then this is something that you can look into. So what do we do to help these patients? How can we help them manage? So since most of these patients are obese and overweight, you want to start with conservative management, and that is weight loss and lifestyle changes. Now, weight loss can be really, really good. for all patients, and it's something that you should recommend even if it is in addition to other management options. Now, using CPAP, so continuous positive airway pressure, is really good, and it's the first line for moderate or severe um, obstructive sleep apnea. Now, some people can't tolerate the CPAP, and so you can try an intraoral device, or someone with mild sleep apnea where they have no daytime sleepiness, you can also try an intraoral device as well. Now, if the sleep apnea is causing excessive daytime sleepiness where it's really affecting them or it's unsafe for them to be on the roads, then the DVLA should be informed as well. All right, so now let's move on to that SBA and see that if you guys have been really paying attention to what's been going on, and so you can just give yourself a little test. I'm not going to read through the whole question right now, so feel free to pause it. In about 10 seconds, we'll break this question down. All right, so let's go through this question. If you want to, feel free to pause if you're not done answering yet. So it's a 41-year-old obese man, so that's a key symptom. It's obese middle-aged man with loud chronic snoring and gasping episodes. So again, these are key symptoms you're seeing. He's reporting unrefreshing sleep, so he's waking up tired, and that's because he's not sleeping properly, and a morning headache. And that can sometimes happen if someone is experiencing a level of hypoxia. He has excessive daytime sleepiness, which is interfering with his daytime activities, and he was almost in a motor vehicle accident recently. And so that obviously is a concerning sign of maybe this is a lot more serious and he just hasn't had it checked at all up until now. So he's been treated for hypertension, GORD, and type 2 diabetes. So these are the things that are included in the question so you have a better picture, but they're not particularly relevant to what this patient's diagnosis or management would be. So based on the most likely diagnosis, what is the most appropriate next step? So of course your most likely diagnosis is obstructive sleep apnea. Now, because it's interfering with his daily activities and he was almost in an accident, hopefully we've all picked the same appropriate next step, and that is to inform the DVLA due to the excessive sleepiness. So because his excessive sleepiness it's unsafe for him to continue driving, he was almost in an accident, you need to inform the DVLA. So good job if you got it right, and if not, that's okay. You're never going to make that mistake again, hopefully. Alright guys, so let's just go through a quick summary of everything we've discussed. So again, those key symptoms we were talking about: excessive daytime sleepiness, episodes of apnea, episodic gasping, and snoring. Now, again, as you saw in the question, if it's impacting their daily activities, if they're at risk of getting into accidents, you should inform the DVLA. Now, diagnostic testing is the polysomnography, but if you want to just generally, you can do that. You can do the sleep scale or the sleep latency test. And of course, weight loss and CPAP are first line treatments for obstructive sleep apnea. And remember to always start with conservative management, even if it's in addition to medical or surgical management. All right. So that's everything about obstructive sleep apnea. It's not a very big topic, but it is an important one to be aware of. It's something that many patients can come in with. Please make sure to subscribe to the Teach to London channel, and so you can stay updated with all the latest videos. If you need anything or have any questions, again, feel free to message me on Instagram, or you can just email me, or feel free to leave a comment down below as well. Thanks, guys.